All right, say good afternoon. Welcome everyone to our Wake County Board of Education work session. It's January 19th. It's about 2:35, and so we will get started. We are here in the board conference room at Crossroads. We have everyone with us except Mr. Hegarty, and I'm assuming he will be joining with us shortly. So I'm here with all now 8 board members and Superintendent Moore. We'll get started with our agenda. We've got several items on the agenda for today. The first item is an overview of the 2020-2021 magnet recruitment effort, and that's being brought to us by Wade Martin, Kimberly Lane, and Tamani Anderson Powell. So I will turn it over at this point to first Superintendent Moore. Any comments, or do you want to dive right in with Mr. Martin?
For the magnet recruitment, we are in the middle of our magnet recruitment period. We do still have a couple of weeks for the application period, and thought it would be helpful for the board to understand how that's going. Go ahead and turn it over to Wade.
All right, thank you so much. Good afternoon, Chair Sutton, Superintendent Moore, and members of the board. We are excited to be here this afternoon to share an update with you about the important work happening to support our 2021-22 magnet school recruitment efforts. With me today is Kimberly Lane, our new Senior Director of Magnet and Curriculum Enhancement Programs, and Tamani Anderson Powell, Director in our Magnet and Curriculum Enhancement Programs. Following a review of some relevant data and an overview of our district and school efforts since October, we will be happy to answer any questions that the board may have. Ms. Lane, at this time, I will turn it over to you.
Thank you, Mr. Martin, and hello to the board. I think this is the first time I've had the privilege of being in front of you in Wake County. I did want to just briefly introduce myself since this was my first time. I'm an educator 20 plus years, and I've been paid 20 plus years. I jokingly say that my mother was a teacher, and that was the time when we spent all snow days, all work days in the school with the teachers. So I was there with my mother a lot. Started substituting when I was a high school senior because I was in a different district. That was long before substitute certification days. During college, I decided that journalism was a better path for me, and did some work for 15 years in business and industry, and then had my children in school, and the principal said something to me in the hallway about it was time for me to join their ranks, because there's something about education. It just pulls to you. And so I went back through the NC Teach program, taught middle school, was a high school magnet principal before joining the district office in 2 urban districts as the advanced academics and magnet director. And then I have been in Wake for 6 months, and very honored to be here with an esteemed group of colleagues. The most important thing to know about me is I'm a new grandmother. I have a 1-year-old granddaughter and another one on the way due the end of March. So I love children. That's why we do what we do. So thank you, Ms. Hodge, for going ahead and advancing the slide. I think it's always important as we talk about our magnet programs that we revisit the principles that the board has approved, so that we recognize that our programs are important as we work to reduce high concentrations of poverty, that we promote diversity, particularly through school integration, maximizing the use of school facilities, as well as providing innovative and/or expanding educational opportunities. Next slide, please. Just a quick visit with our magnet application and selection objectives, and there is a link included there if anyone wants to visit that. We do consider 2 key factors when we're considering magnet applications, and the first is the projected overall socioeconomic status of the school to which the student is assigned for next year, as well as the socioeconomic status of the area where the applying student resides. So as we look at these numbers, it's important to keep in mind that the entry grade siblings, our kindergarten, 6th, 9th grade students of returning magnet students, are guaranteed selection. And I'll pull that out in the data when you see that in just a moment. We do provide priority for our students with magnet status and base students following their program pathway. We mentioned the priority for students assigned to schools living in areas considered high or medium socioeconomic status. And we reserve 5 to 10% of seats at each magnet school above and beyond the priorities, and that selection is based on a lottery number. So as Mr. Martin said, and Superintendent Moore, we did want to bring you information, and I think it's important that we are looking at comparative data. So because we are still in the midst of magnet recruitment, we wanted to take a look at where we stood as we finished the year. So we are comparing numbers from October through December of 2019 to our current numbers through December the 31st of 20. So year to date, magnet year-round schools are down a little, 319 number of applications from 2019. And our early colleges are down about 512 applications from 2019. We did want to note that we had in mind that because our enrollment is down throughout the district, that we wanted to allow as much time as possible for our families to learn more about the virtual environment and planning for next year. And in doing so, we extended the early college deadline. And I think it's important to note that we did add almost 500 applications during that extension. The next slide actually breaks down for you. Again, the comparisons are the same time frame, October to December 2019 versus October to December 2020. And it is broken out by grade span. So you see elementary, middle, high, and then our early colleges separately. We'll also see the numbers. Because we do add the siblings automatically, that second column are those automatic additions at the middle and high school levels. So you see that we're slightly down in elementary, about 14% down for middle school. We are up almost 3% for high school, with an overall total of being down about 7%. That's the 319 count. Our early colleges were off a little bit more, and that's the almost 29%. One of the things that we wanted to bring to you is not only how we support our magnet programs in terms of recruitment, that's always a continuous improvement process. Tamani and Tasha, our marketing team working with the magnet coordinators, do a great job every year of making sure we are reassessing our recruitment efforts, what's working, what's not, where it's working, and really trying to improve upon that process. But the virtual environment has been even more of a challenge this year. So Tamani's going to share with the board several things that we've done that we normally would do, but also in addition to that. So Tamani, I'll turn it over to you.
Hi, everybody. Good afternoon. Thanks for allowing us to share. Thank you for this time to continue to promote our magnet schools. We are always excited to share information about these amazing schools and programs. So you'll see on this slide that this year, of course, all of the things that we had done in person last year, we had to pivot quickly and host in a virtual setting. So it took us some time. We were able to find a platform that worked beautifully for our purpose. We are used to, of course, having far more people attend, but we're excited for the people that did get a chance to attend our events that were held virtually. So at these events that are listed, I just want to share with you that each school had their own virtual booth. So when you access the site, the platform, then parents could scroll down and click on a virtual booth to get information directly from the school, from the principal, from the magnet coordinator, from teachers about the program. And our schools got really innovative with ways to share information. So they created virtual Google Classrooms with links inside, or other opportunities and other meets where parents could learn a little bit more about their program. The early colleges set up a room just for students to share with other students, or for parents to share with other parents, or for specific teachers to share information with parents who were interested in maybe that particular program at Vernon Malone or North Wake. So I'm really excited about this platform. Tasha and I have already talked about next year, even when we do things in person, we're going to continue to host some virtual events. It was wonderful because parents who didn't even live in Wake County, didn't even live in North Carolina, were able to attend those events in anticipation of moving here. So we felt like that was a win for us. We will continue, of course, to work with our schools. Each school is hosting their own virtual event. They're doing lots of different ways to share with families. We will continue to work with schools to host those. Beth, you can go to the next slide. Again, we've pivoted, and so where parents would come to the building at Crossroads and maybe schedule a time to meet with me, I created a calendar where parents can now schedule a Google Meet with me. So Thursdays and Fridays, and now I've added Mondays. I set aside 20 minutes for each meeting where parents can just join me and they can talk virtually face to face, but I think it's been really helpful to be able to see the parents while I'm talking to them. I continue to monitor our email. We have an email address that's just Magnet Center, so they don't have to send it to T. Anderson Powell. They can just send it to Magnet Center, and I watch that daily. And of course, as we get closer to the end of the application period, those emails go up. So I just want to let you know that I'm up late at night helping those parents because often they're emailing me a question that I can quickly help them with, and they can go ahead and complete their application. Typically, we host in-person parent info sessions. We've been doing those virtually as well, but now we've scheduled some during the day and some in the evening. So that's another thing that we will continue next year is we'll still host some in-person, but we'll do some evening virtual sessions that will help parents who work during the day. That will give them an opportunity to learn and ask questions. I started 2 years ago doing Facebook Lives. At first, I was just doing them in my office. Now we're taking the show on the road, and this year especially, it was great to get into the schools and give parents a chance to see, at least inside some of the classrooms. Some of the things were staged. We had children who could come in and maybe talk about some of the activities that they might do at their school. So you can see we've gotten lots of views from those, especially because parents can't get in the building, but we've tried to provide an opportunity for them to see inside the building, see the classroom, see the program in action. So that was a great pivot for us. You can go to the next slide. We always kind of have district-based recruitment. Those are things that Tasha and I do to either reach out ourselves to daycares, preschools, moms groups, or how we support Magnet coordinators with doing that. So we've done several virtual PLTs to help Magnet coordinators make that transition to virtual. A lot of it was just letting the Magnet coordinators share amongst themselves. There are some super creative Magnet coordinators, and they would do things. I was like, oh my God, Tasha, look at this. And then we would ask them if they would share that information with other coordinators. We did have to move to a different platform, Booth Central. It's been amazing to work with, and the first couple of times it takes a little bit. So once I learned it, we did lots of training to support schools on creating these virtual booths that were really engaging for parents. We continue to do outreach to daycares and preschools, and I've done several virtual preschool events. I have another one tomorrow evening at 2:30. And then this year I created a how to apply video. So I did screenshots of step-by-step how to apply to a magnet school, how to apply to an early college school. We've shared those with school counselors. I've sent information to charter schools to be sure that those families are aware of the application period and help them with trying to be sure that they are able to complete the magnet application. Again, you'll see here the Facebook Live and Google Meets. And of course, we increased or tried to increase our target outreach for our first generation college going families. So we hosted an early college fair that was on a Saturday, but we also hosted another early college fair that was during the week in the evening. And we really tried to reach out to schools in Eastern and Southern Wake County to increase the number of first gen families that are aware and that applied for early colleges. Beth, you can advance. Beth, you can advance the slide. There we go. So this year we always do mailings, but we've increased our mailing this year to families. We've really tried to increase our ad placement in places where we know families are looking, WRAL, Carolina Parent, Carry Magazine. We've done e-blast. We've recently, last week, had a social media training on how can we better utilize our social media and be sure that it's being seen in the right places by the right people for applying. We have created our event flyers and made sure that elementary and middle school counselors have those to share those with their 5th and 8th grade parents as they're looking to move to middle and high school. Again, last year we actually, Tasha, I'm not going to take credit, Tasha worked with the Office of Student Assignment to create a digital district map that shows preschools in the target area. So you heard Kim mention earlier about the selection process and how we are looking to select families whose base school and home address are considered medium and high. That's how we create that economic diversity that is the purpose of magnet schools. And so we now have a map where we can identify daycares and preschools in those target areas and really try to engender relationships with them to help those families that have a better chance of being selected, to encourage them to apply. We also supported them by creating new marketing materials, new outreach efforts. We've just tried to, we, meaning Tasha really, about the marketing materials, have really tried to up our game as we look to try to engage parents in a very different environment. You can advance to the next slide. And schools, of course, are doing the same thing. So on our website, on the Magnet website, there is one page, kind of a one-stop page, where you can access every school's link for their recruitment information. Schools have created virtual tours and videos to highlight their themes. Again, those schools have used that digital map to reach out to daycares and preschools that in the area that they serve. They've done direct mail to people. They've engaged with parents, of course, on social media. They're also doing Facebook Live and Google Meets, and the early colleges are continuing to reach out to those first-gen families. We really want to get those students involved, and we understand that we're going to pivot a little bit next year and start trying to work with maybe 4th graders and 7th graders to engender that relationship early so that 8th grade or 5th grade is not the first time they've ever heard of an early college. That we really want to help those families begin thinking earlier about being a part of an early college and what that really means. You can advance to the next slide. And so this is just an example. Go ahead, Kim.
I just wanted to give a shout out for our principals, our magnet principals, and those magnet coordinators, because Tamani and Tasha have done amazing work at the district in terms of that pivot. But our schools have just really met the challenge of all the work that's been required as we pivoted to this virtual environment. Tamani mentioned earlier about the different media advertising. We just wanted to spell that out so you could see that in print. And as Superintendent Moore said, we do have a couple of more weeks in our magnet recruitment season, so we will be back with you in February to really analyze the data at the end in terms of the end results. Again, thank you for having us today and for sharing. We appreciate the opportunity and are excited about all the things that we've been able to accomplish this year and look forward to the next 2 weeks of recruitment as we go heavy toward the end. So we will open it up for questions if the board has any that they'd like to ask.
So thank you for that update, Mr. Martin, Mrs. Lane, Mrs. Anderson-Powell. Also want to say welcome to you, Mrs. Lane. We are grateful to have you, and congratulations on your status as a new grandmother.
Thank you.
Board members, just wanted to make you aware that, although just as a point of reference, Ms. Lane is serving in a position that was previously served by Dr. Beth Cochran. So for those that may not recall, I think she retired, right? Yes. So with that, any questions board members at this time. Mrs. Scott.
Thank you, Mr. Chairman. Thank you so much for this presentation. I know that we've all been curious about the efforts and understanding just how much COVID has impacted recruiting for our magnet schools. And I was just wanted to ask because in my district in particular, there are some of our magnet schools that exist to try to retain students. And we understand right now this has been this is a challenge for all of our schools right now with market share. And I was just curious if there are any other efforts that have been that you could share with us that have been taking place at some of these schools that are our equity magnets.
So I'd like to share, Ms. Scott, one thing that we looked at this year. We know that the equity magnets and their location sometimes hinders their ability to attract the target market that we're looking for with other magnet schools. So this year we worked with Student Assignment to look at the number of available seats at those schools and then look at considering students along the entire selection priority. So you heard Ms. Lane talk about, high socioeconomic, but for Zebulon, Wendell, Smith and Hodge Elementary, East Garner Middle, and Garner High School, this year we decided to look at the number of seats and then consider all of the selection priorities all the way down to low, to help them better fill some of those magnet seats that they have.
I appreciate that so much. I know that our magnet coordinators at those schools do an excellent job balancing needs that look very different from some other magnet schools in the county. And they do a great job. And as the parent of a rising sixth grade student, we've enjoyed the magnet tours. And I do just want to give a shout out to our magnet schools and to all the work that you've done, because the virtual fairs have been outstanding. And I really appreciate the outreach from the schools and the follow-up that they offer. It's what we've experienced just as a family in the mix of that has been great. So thank you so much, and I appreciate the answer to that question.
Thank you. We also worked with Student Assignment to look at students who live in that area but not attending, and to do some outreach with those families to maybe try to draw them back to the school. So we did work some this year, and we'll continue to work with Student Assignment to identify those families and try to do some direct marketing to them and attract them back to those schools.
I appreciate that feedback so much. And with a lot of the new neighborhoods coming in too, I mean, it's always a great time to be able to introduce ourselves to there, where we have the little, this is where whatever that's called. We're in a new neighborhood when you go in to pick out your house. So I appreciate all of that. Thank you so much.
Mrs. Kushner.
Thank you, Chair Sutton. And to piggyback off of that question, this is probably more for Mr. Martin, if we are expanding, because sometimes the base school that is not a magnet, parents are looking at all these virtual tours for magnet schools, but their base school remains certainly, and especially now in a pandemic where they can't go visit their base school, is an unknown. So have we thought about expanding also marketing and just information online for our other schools that aren't magnets, but that parents need information so that they can make the best educated decision for their student, whether or not to apply to a magnet or to remain at their base school? Because I don't want us to, and to Ms. Scott's point, thinking of market share across the entire county, I think we need to look at that as a school choice model and priority for your officer.
Ms. Kushner, that's a great question. And one of the things I would share with you is we did not expand the current platform that we used for the Magnet Fair to all schools. The Magnet team, in conjunction with Kelly Creech's office, did actually establish some protocols for us to be able to host some on-site, very small guided tours. And that information was shared with I know our magnet principals, moving forward as we continue to transition forward, we could certainly continue to expand that to all schools. But we were able to identify and create some very easy to follow guidelines and protocols for us to be able to host. And obviously, this was pre Christmas break holiday, but we were able to actually facilitate some on-site small guided tours for families that didn't have an option for that virtual connection to our schools.
And that was for any school or just the magnet selection?
That it began with our magnet schools, but now that we have that protocols and practice in place, we
gotcha.
could certainly expand that to all schools.
Okay, thank you. That's good to know, and I again just want to underscore the need for us to just promote every single one of our 192 schools. And I was glad to see the uptick in the high school level. That was intriguing to see at the magnet. So congratulations for all the great work. Thank you.
Thank you.
Ms. Haggerty.
Thank you, Mr. Chairman. Just quickly, I'm not surprised to see some of the applications dip a bit in the environment, but I was curious if those declines were across the board, if you saw them to be more unbalanced. You know, some schools continued to receive applications, other schools might have dropped more than others, and why you thought that the early college applications were what seemed to be a lot lower than they'd been in the past.
Well, I'll start, and then I'll let certainly Ms. Lane finish up, because I know that she worked closely with Mr. Domenico, really analyzing the early college data. One of the first things that we talked about as a team as we looked at that dip in early college, and we really that surprised us, honestly, because that smaller, more close-knit learning environment we thought might be even more appealing at this time. One of the things that we kind of came to a conclusion around is, while we have really done a phenomenal job as a district in identifying protocols and practices to keep students safe, we kind of lose control of that process as some of our students transition onto the college campuses. And I think there's a lot of unknown as early in the school year, colleges transitioned from everyone being on campus to off campus to virtual. I think there's still some unknowns in terms of what next year may look like for some of our college partners. We are encouraged in that once they have kind of a standard platform that we're hoping that they'll be able to share with the community, that potentially through similar to what we do this year with some second chance opportunities, that we'd love to be able to open that back up for families that were interested but just weren't ready to commit with the unknowns with some of our college and university partners.
And I will speak to the question about looking across the school. We have worked closely with student assignment to look at that school by school data, and we don't see a particular dip at any one school. It just seems to reflect the district's enrollment in terms of that, but we'll continue to look at that, and then we'll again come back to you in February with those final numbers. I do think, Mr. Martin's, our talking with the early college principals and asking that very question about what they're seeing are a number of things. Part of it was the timeline for the early colleges. So keeping in mind, if we hadn't extended the deadline, it would have ended before the Christmas break. And at that point, families were still trying to assess kind of where we were finishing out this year and thinking about next year. So we are very hopeful that January is going to bring much more in terms of volumes of applications as families have moved past the holidays and are starting to think about next year. So we saw that reflected in extending the deadline for early colleges by the increase of the 500 applications. And we're again hopeful during that second chance that we can make another strong push.
That sounds great. I appreciate those answers. Thank you.
I wanted to ask a question, and this question is for all of you all and probably Superintendent Moore as well. When we think about, we've often prided ourselves on offering choices to families, and we were even at one point sort of using the term pretty often, choice with a purpose. So as we think about that and increase the offerings, particularly in our non-magnet schools, that sometimes even puts pressure on our magnet schools to embrace some of the goals and the work that we're doing around keeping our schools balanced, healthy, and integrated. What are the policy or fiscal, if any, considerations for the board, and what are we doing in terms of thinking about emerging magnet themes or that sort of thing? I mean, I appreciate the part here and focused on the marketing and promotion. What sort of proactive things are we thinking about to stay ahead of the game as we continue to keep both our magnet and non-magnet schools and programs strong? So what are the, I guess my question is around the policy and the fiscal implications or considerations for the board that we need to be thinking about as you all continue to do the fine work that you're doing around strengthening our magnet programs.
I'll mention a few things. I think, first of all, understanding and how our community understands that magnet schools and application schools are open to different parts of the community based on what families may have an interest in and what their children may have an interest in. Schools may offer programs that are not magnet schools or application schools, and those programs serve the base community. They're not open to other families to apply to. And so I think understanding where those are and how that happens so that we've got good language when we're talking to our families about what their options are is important. I also think that there's been some conversation that the board has had here and there, some of it as part of the work that we've done with RTI as well, around whether or not how we offer choice to families might need to be more strategic in the sense of right now, all calendar application families who receive a calendar application that is listed for their address receive neighborhood bus service. Is that something that facilitates or does not facilitate the larger goals of the district? So, and those become individual sort of school by school type decisions, can get very, very complicated to deal with. But that's one place, just in levels of transportation. So I think that as you move forward, what you've got to look at is the data of who's in our schools and what is by choice, what is by assignment, what is by transfer. Those are all different: application, transfer, base, right? All of those. Calendar, that's a piece of it. And we've done some of that work in the past. And generally what we have found is that it's families who choose magnets have very specific reasons and background or history around why they choose those. Calendars is a little fuzzier. And then, of course, our early college schools have specific criteria that we try to shoot for in a percentage of the folks that are accepted there. So I think it's really looking at slicing all of the choices and the pieces that go with each choice around, in particular, things like transportation or calendar, and determining whether or not you want to slice any thinner based on the overall goals and objectives of the district. So
I appreciate that. So with that being said, then how not sure how to ask this, but what then is the appropriate balance in terms of marketing, if you will, when you look at this presentation and that we do the heavy push on magnets? But as you talked about the calendar schools, the application schools, how do we market that sort of comprehensive effort so that there is that understanding in the community and in parents of all the pieces that you mentioned and how all of these sort of work together or in a sort of an interconnected sort of way? Does that make sense?
yeah, I think we have to align on clarity around the purpose of application magnet programs in schools and be able to specifically market with that vision and mission in mind, so that there's not a lack of understanding. We run into this when I said earlier about school-based programs like CTE academies. Those are occasionally we will get requests from families who want their child to participate in a CTE academy that's at a school, but they're based at another school. And there's a lack of understanding that those academies belong to the school and serve the base population of that school. They're not open for application. But we run into issues where you, as a high school, you don't always know which kids are coming to you. So you'll receive an application from a family that you thought was coming to you, and you review it, but they're not actually in your attendance area. So that can cause some complications. So there's work that we would have to do internally to ensure that as we communicate externally, folks are clear, but it's also very helpful for the full board and staff and everyone to be aligned and on the same page with the mission and the vision and be able to communicate that.
Okay. Thank you for that, because I know, we often hear our parents talk about, as they come, particularly new parents to the system, there's so many schools, so many offerings, it's hard to figure out how it all works, and then they see so many options on the menu, if you will, but often they don't have access to all of them, and so we've talked a lot about here as a board, those being real choices for families, and they're being able to access those choices. So, all right. Again, thank you, staff, for that presentation. We'll move on to the next item on our agenda, and that is an overview and presentation on a better wake. And so I'm going to turn it over to Superintendent Moore, and we've got some special guests, I think, from outside the district that will come and share with us this afternoon.
Thank you, Chair Sutton. And sometime in the last couple of weeks, I had an opportunity to meet with, virtually, Adrienne Cole, the CEO of the Greater Raleigh Chamber of Commerce, and Danya Perry, who works in their office, and on the initiative of A Better Wake, which has been messaged some in the community in the last few days quite a bit. Their request was, as they look at A Better Wake as a community initiative, the role and potential of partnership with the school district in this work moving forward. You'll see why they're asking that as Danya goes through the presentation. I'm not sure that Adrienne Cole was able to join us today. She had a conflict, so she may not be on. It may just be Danya who's presenting, but I'll go ahead and turn it over to him because I do believe he's on.
Good afternoon. How's everybody doing?
Doing well, sir. How are you?
Doing good. I apologize that Adrienne will not be able to join us, but so you're kind of stuck with me, unfortunately. But thank you, Kathy, for the introduction. Really excited to share with you the work about A Better Wake. Just to kind of give you some context, my name is Danya Perry. I serve as the Director of Equitable Economic Development with Wake County Economic Development, which is a division of the Raleigh Chamber. And at the Chamber also serve and lead their diversity, equity, and inclusivity work. After the tragic events, the murder of George Floyd, Breonna Taylor, there's been this renewed energy and the spirit of our collective community to really focus on what can we do to help support anti-racist work and to look at structural and infrastructure racism. And around May, I would say that initiated by Mayor Baldwin, by our county commissioners, other leaders within the community, folks coalescing around what are our next steps? How do we collectively create an opportunity to really dissect some of the disparities that we have within our county and community? And so that, along with the leadership of the NAACP, Gerald Gibbons Jr., we coalesced around this A Better Wake movement, and ultimately it became a space where we can actually design and pull together a collective commitment in which we will all galvanize under. If you can go to the next slide. So our charge and our commitment, and go to the next slide, please. You can read it, but I'll go ahead and state it, just not only because I think it's a great statement, but a statement of commitment, but I think is rather powerful. We acknowledge there's a high quality of life in the region for many, but for those who have been historically underserved, underrepresented, and marginalized, there's a different reality altogether. That reality is rooted in systemic racism. It has permeated the justice system, created monumental education, health, and wealth disparities between Black and brown and white Americans, and resulted in discriminatory practices. This moment is the culmination of such injustice. And this statement that we are seeking to gain some momentum and support, we are really going to dive deep into, if you can move forward a couple. Our vision is focusing in on 4 primary pillars, looking at addressing education, economic mobility and inclusive prosperity, health equity, and criminal justice reform. So when we talk about structural and infrastructural racism, we're talking about really understanding where we see disparities in these 4 areas. It's interesting because most people ask the question about this movement being led by the Raleigh Chamber, and but again, this being sort of a collection of a community, we are serving as a convener. But we also want to make sure that we help drive this momentum and really create an awareness around why it's important, build our fluency in this space. So when we talk about structural racism, understand the systems that we've identified. If you can move forward, please. So our ask of not only the board, but our community at large, we had a formal launch yesterday on MLK Day during the MLK Interfaith Breakfast. We have been pushing the website, and we're asking for your commitment as a community member to commit to this statement. We're asking for you to share this information within your own networks, within your colleagues, within in your personal lives, social media, and then as school board, asking you to endorse the commitment statement. And your endorsement, all that we ask for is to you provide your logo, to sign up, to pledge that this is important and it aligns with the value proposition of the school board. So far we have, and if you don't mind, please moving the slide forward. We have these companies that have already signed up. We have, I would say at this point, tripled this amount. These companies were part of our initial collective in coming up with this statement, along with a couple other entities. But we're collecting right now organizations and businesses from around the county that are committing to this. Advance the slide, please. Now, in our website, this is our linchpin. So on the website, we've created a clearinghouse of information for an action guide, if you will, of practices that you can solicit to help support anti-racist movements as an individual community member, but also as an organization and/or a company. We are also asking for you to share this information on your social medias. That means in sharing the toolkit as well. If you don't mind advancing the slide. And this is just a picture of our couple, which it's live now, so you can definitely check it out at abetterway.com. Move forward, please. And our toolkit, this toolkit that we're asking for you all to use in your promotions if you decide to align with the work. We have a one-pager, sample press release, some email templates, and also some social media towels. We've also released a video that you can also use to share, just I think it's around a minute and 15 seconds, just talking about the initiative. Our goal at the end of the day is, and what we're soliciting now is to work with RTI, which is to endeavor upon a 9-month study that will dissect those 4 systems and really provide us some recommendations and some guide rails on what needs to change in regards to practices, policies, and programs that can help us dismantle systemic racism. At the end of the process, we hope to have a forward community-facing dashboard that will give us the metrics needed so that we can ensure that we're actually moving the needle. Again, we recognize that there are a lot of detractors in this movement. There's a lot of individuals that do not necessarily think structural racism is a thing. I think it's important for us to be able to justify it empirically, to also be able to show the opportunities to be able to make change based upon, like I said earlier, the policies, practices, and programs. Our lead partners, again, with the City of Raleigh, County, the Raleigh Chamber, Triangle DEI Alliance, and also our local NAACP. So we're really excited about this presenting to you, but also excited about the opportunity that this holds for our future. So are there any questions? I'm more than happy to answer them.
Tanya, thank you for the presentation. Good to see you, good to hear from you, and certainly appreciate the work and all that you have put in, as well as the Chamber, to move this effort to this point. Are there any questions from any board members at this time? Ms. Mahaffey.
Hi, thank you for sharing this. I'm curious, what is your outreach to the other chambers of commerce across Wake County?
I love that. Well, and to be completely honest, that is why Adrian's not on this call right now. We had to schedule, we scheduled 2 accompanying meetings, and so we're meeting with all the chambers to talk about their commitment. We've met with them individually, but we're doing a formal meeting to talk about their engagement, and we have not received any pushback to date. So really excited about them using it to also promote within their business communities.
Thank you.
But don't tell her I told you that.
No one's recording this.
Mrs. Scott.
Thank you. I very much appreciate this information, and I was trying to think of a way to share this. Last week, my husband had shared, just sort of anecdotally, some of the information that his company, which is a major company that has over 160,000 employees around the world, and part of their anti-racism and their equity work, he was reading to me the slide, which of course, or no, he wasn't. No, he was just giving me the general idea. He was certainly not reading it to me. But he was sharing that with me, and he said something, and it made me realize that, you know, this work is important, not just to dismantle these systems for the sake, because that is the right thing to do. That is something that we need to do. But this is also, I mean, this is the work that our children, that our students will be expected to also understand in their studies at major universities, and you know, also with major corporations that they go on to work for. And I think that, I mean, I know we certainly have not. I'm very supportive of this collaboration that I see in Wake County, especially with chambers, and I think this work the Wake County Public School System is already committed to doing. We see that in our Office of Equity Affairs and how much we respect the work that they do. So I just wanted to share that. Thank you.
Thank you, Mrs. Scott. Mrs. Kushner.
Thank you, Chair Sutton, and Mr. Perry for being here today, because I think the 10 months in, this pandemic, this global pandemic, both globally and in our nation, has exposed all 4 of the focus areas that you highlighted, the gaps and inequities in education and economic mobility and health equity, as well as the criminal justice system. So this work is incredibly important, and I appreciate the Chamber taking the leadership as a convener for our community. Thank you.
Mrs. Cash.
Thank you, Ms. Mahaffey, for also mentioning other chambers. I think it'll be really good for this board, since we are a county board, to hear from all the different chambers in our county. And then when it comes to what our school's role in this is, that it's one thing to take a viewpoint, but if we don't take actions such as integrating our schools and taking the magnet program very seriously, it's all words and not action. So I just want to emphasize that as we're talking about magnet recruitment and our schools being closed, that there's a lot to be done by the county school system in order to take action rather than do words. That's my point of view, but I'll be listening to what other chambers, how they feel about this, and then we as a county can look at that.
Thank you, Mrs. Cash. Ms. Johnson-Osler.
Thank you. Thank you. I certainly echo the sentiments and thank the Chamber and the CEO, Ms. Coles, for leading this effort, and certainly glad to see that we've seen several leading businesses in our community already sign on to this. And very similarly, I guess that really is ultimately my question. No doubt about it, I think this very much so aligns. Many of these companies had people serve on our strategic planning task force, and we talked exactly about the impact of all of these things to globalization and what our young people will have to look forward to in their careers and continuing education efforts. So I guess my ultimate question is, in terms of actions and doing, other than signatories, how else do you anticipate the schools or the entire district engaging as a partner in action and not just signatories?
I love that question. Our goal is, once we start to, there's our RTI project will start in its first 3 months in identifying sort of an advisory committee in any of those particular pillars. And so what we like to do is be able to bring the school system into some of those conversations to talk about, and as they're building the recommendations and also pulling on national data experts. We're pulling together Brookings Institute, Opportunity Insights at Harvard, and also Policy Link, along with a couple other entities, to help us support building together an actual set of recommendations. So we need some local input, not just from the school system, but also from the other pillars, to help create, again, those recommendations that we're going to ask of each entity. Now, the chamber, we are not, we don't have the capacity to hold anybody accountable. But what we're asking is for this to be a collection of the willing, to take this information, to take this report, to take the recommendations, and then to act upon those. So we're hoping that this can have a really great intersection for the work that you're already doing, but maybe it can uncover some gaps as well that help support and justify the work that you like to see in the future, or the improvements that you would like to see in the future. Does that make sense?
It does, thank you. So one clarifier, when you say school engagement, is that at the onset with RTI as they develop the recommendations, or on the back end of reviewing, or both?
It's both, but more importantly at the beginning. The first 3 months, we call it's our phase one, which is just collecting data and collecting input. And so once we pull together both local and national experts, then that'll really help provide us a really strong baseline.
Okay, thank you.
Dr. Martin.
Thank you, and thank you, Danya, for the presentation. I'm really excited to see this work getting kicked off. It reminds me of our own work that we started a couple years ago with RTI, and that in that work, I think we recognize that the school system can't work alone. Likewise, the county and the chamber can't work alone. So this really needs to be a partnership, and I think it points to, if we become a little bit of students of history, the work integrating the Raleigh City Schools and the Wake County Schools back in the mid to late 70s had such a major impact on making our community what it is today, both from an educational standpoint and an economic development standpoint and a quality of life standpoint. And I really sincerely believe that we're at a time that if the business community and the education community and the greater community come together, we can have that same kind of impact going forward in the future. So I look forward to the partnership. We all need to roll up our sleeves. I think people have said it's got to be more than just signatures and statements, but real hard work. But I'm excited about the work. So thank you for coming and being part of that effort.
Thank you. My pleasure.
I want to, again, thank you for the work, and I just want to share a quick little story, as Dr. Martin touched on some history. Back in about, I think, 1995 in Rocky Mount, and this was a time in Rocky Mount where Hardee's was still headquartered in Rocky Mount. At that time, what is now PNC was RBC Centura Bank. It was also headquartered in Rocky Mount. And at that time, you had the oldest and most prestigious country club in Rocky Mount that in 1995 still did not allow blacks as members of that country club. And so the business community and several CEOs thought that that was a tremendous economic development barrier when you had companies like RBC Centura, Hardee's, Consolidated Diesel Company, which at that time, and I think still does, made the only diesel engines for Dodge Ram pickup trucks and that sort of thing. So you had premier employers in Rocky Mount that stood up and said we needed to make a change in Rocky Mount. And so they approached the chamber, and some of the folks and names that you all might remember, names like Angela Bryant, Cale Landis, who just passed away, here were part of this effort to start a program called Common Ground. And at that time in 95, it was believed to be one of the first, if not the first, efforts by a Chamber of Commerce to address and improve race and community relations. And they chose a young man who hadn't been long out of college to be the first executive director of that program and help get it off the ground. And that young man was me. And so I spent about 2 years working in Rocky Mount, my hometown, working in a similar effort as this, that the Chamber thought was important enough to address race and community relations. Had some success there, and then that was in, I think, about 1997, where I left there and went to become the executive director for the state NAACP. And so I'm excited about this effort and the role that the Chamber is playing to address this important effort. Excited about the partnership with the Chamber and the NAACP and other partners that I recognize and I'm excited about. And so I certainly would like to commit my effort, enthusiasm, and that of this board as we express our interests to help support this effort and make it be as strong as it can be and be a strong partner in the way that we can. So I would ask the board to consider at this point, we will think about, Danya, this request and the best way that we can signal our interest and commitment. So let us get back to you, and board members, I'm thinking about anything from a formal resolution or other things that we can do to certainly sign on as a partner, lead partner, if that is an opportunity, Danya, to again signal the interest of the Wake County school system. So if you will allow us to think about this a little bit, talk with our superintendent more, and figure out a way that we can best be a meaningful partner, because again, with education being one of the key focus areas, we certainly want to be a part of, and I think figure out how we might play a lead and significant, and I think to Ms. Johnson-Hotzler's point, an actionable role, and that this is not just a report or set of recommendations that sits on the shelf, or that becomes something just in a piece of rhetoric, but that we are engaged in some meaningful and actionable ways to close the disparities and the gaps that we see in our community.
Oh, awesome. Thank you. Truly appreciate the time. Do you want me to call y'all back in 10 minutes or how much time?
Why don't you send me a text in about 15?
Okay. All right.
We'll certainly, like I said, we'll work with our superintendent, and I'm sure that she and Adrian will connect and perhaps sit down with you and Adrian, and again figure out the most appropriate way for us to move forward in this endeavor. So thank you for the information, and good luck on the work.
Absolutely. Thank you. You all take care.
Thank you, sir. All right, the next item is an update on the vaccine for COVID-19. Wake County Human Services is with us. And so again, I'll turn it over to Superintendent Moore, and she will introduce our guests as well from the public health team with Wake County to bring us an update on vaccinations.
Thank you, Chair Sutton. As Chair Sutton has mentioned, we have guests with us this afternoon from Wake County government who are going to be able to provide an overview of what's going on with the COVID-19 vaccination process and structures in our community. We know that this is an item of interest for our board and our educational community, so I thought it was helpful to invite them and ask them to provide that overview. Joining us this afternoon are Jonna Sharp, who is well known to the members of this board. She's the Chief Operating Officer for Wake County government, and she has a couple of folks who are possibly with her. Jason Wittes, who is the Pharmacy Director for Wake County Public Health, and/or Dr. Kim McDonald, who is the Deputy Human Services Director and Medical Director. And I will turn it over to Jonna to get us started.
Thank you, Superintendent Moore. Yes, it's good to be with you this afternoon, board members. And we're just going to get right to it. And Dr. Jason Wittes is going to walk you through a brief presentation about where we are with the vaccine. And then we'll be happy to address any questions that you have for us.
Thank you, Jana. Morning, everyone. So today I'm going to go over some of our basic mass vaccination campaign that we've been underway with. So we started the week of December 22nd, and this document that you see here was provided to us early on in the planning phase from the CDC, from their playbook. And this was the intended course of the vaccine rollout. So we are still all the way to the left in limited doses available column. We are right where the line starts to go up on the graph, and where you will see the red line vertically, around 660 million cumulative doses available. That's where you'll see doses of the vaccine or vaccine products widely available into the market, right? So not only in local health departments or hospital systems, but also at pharmacies, your local primary care doctor, urgent cares, similar to the flu shot, right? Where it is just broadly available. But we are not there yet, and we have very limited doses available to us, which I'll demonstrate in a later slide. Next slide, please. So what is the state and North Carolina Department of Health and Human Services doing to help us at this time? So they are in charge of all the phasing and priority groups. So they're using the latest CDC guidance and knowledge of statewide conditions to establish priority groups for vaccine providers, to which us, the county, are following these guidelines and phasing. So I know we've seen a lot of pivoting and changes, but on the next slide, when we get there, I'll show you what our current and the latest phases and priority groups are for the state, and which groups have actually been activated to come get their vaccine. So they've also been in charge of vaccine distribution. So they license vaccine providers. There are currently 4 in Wake County with broad distribution. So that is us here at the health department, UNC Rex, Duke Raleigh, and Wake Med. They also determine distribution quantities and allocations, and the state gets their distribution and allocation quantities from the federal level. And it also has a lot to do with, and you might have heard this a lot in the news, of how many doses are currently on hand at the facilities, as well as how many doses have been administered. And as a state as a whole, we're being looked at to determine what our state's allocation is as well. And this is a weekly basis, a weekly process. So we find out on Thursday or Friday, the week prior, of what our week of the next week's doses will be. They've also provided us with the state's COVID vaccine management system, or CVMS, which is a statewide electronic registration system that's in place, but it's not yet live to the public, so the public cannot log on and self-register and figure out what group or phase they might be in. Lastly, and that's still a manual process, that the local health departments or hospital systems or vaccine providers have to manually upload everyone into the CVMS system. Lastly, they've helped us with public information, so establishing avenues for access in terms of location. So that's the Your Shot, Your Spot NC website, as well as education about the vaccine, availability, safety, and efficacy of the vaccine. Next slide, please. So these are the groups. So we are currently, as of today, at 8:30 this morning, we moved into Group 2, which is older adults. Prior to last week, we had been planning to move into older adults, but only 75 plus. And now we are moving into Group 2, which is 65 plus. Also, all healthcare workers that are public and patient facing were moved up from what was formerly known as Group 1B2 and 1B3 up to Group 1. And 1 also includes long-term care staff and residents, and all people in hospital settings who are or decedent care, medical examiner's office, who have a high risk of coming in contact with someone who is COVID positive, home health workers as well. So in Wake County, we have a disproportionate share of healthcare workers, so the number of people who fall into Group 1. We also have a very large population of Group 2. So we have around 180,000 people who would qualify in Groups 1 and Group 2. And that is the current groups that are active. We were instructed by the state that the state will move forward and activate groups as they deem appropriate based on allocations and population and the rate of vaccination. So group 3 is frontline essential workers, which was being followed under the ACIP recommendations of those defined health frontline essential workers. But there's no definitive answer at this point, so we're not sure if they're going to remain as those same ACIP defined frontline essential workers. So grocery store workers, U.S. Postal Service, teachers, things like that, or if that might expand. Then group 4 is adults at high risk for exposure and at increased risk of severe illness. So that's where you're going to see people with comorbidities, included 16 to 64. And then group 5 is everyone else. Next slide, please. So why these priority groups? So group 1 was selected because we need to protect healthcare workers who are critical workforce during the COVID-19 pandemic and at risk for exposure to COVID-19, and long-term care residents and workers who are at highest risk of being hospitalized or dying. And group 2 is to save lives by protecting those at high risk of being hospitalized or dying from COVID-19. Next slide. So why start with people 65 and older? And this was a key change that happened last week that came down from the federal level, and we've adopted here in North Carolina. So the core principle is that we're protecting people who are at the highest risk of being hospitalized or dying. So if you look here to the left, it's people in North Carolina 675 or older, 65 and older, and then the U.S. as a whole. And it shows you the percent of cases that they make up in that state or the federal level and the percentage of deaths. So if you see 65 and older makes up 83% of deaths and 75 and older is 60% of deaths. Nationwide, it's around 81%. So as of December 20th, 2020, the cumulative COVID-19 associated hospitalization rate was 1,211 per 100,000 people age 75 and older, and 642 per 100,000 for those aged 65 to 74. So these people in these groups are disproportionately affected at higher rates of morbidity and mortality. Next slide, please. And this shows a weekly trend to what I spoke to before. So the number of deaths in Wake County specifically, as we move down, so the bottom of the chart is showing March through January 3rd. This speaks to our first real peak. And the good thing is that more people are being treated earlier on. We have better medical outcomes and medical interventions by our hospital systems to ensure better health outcomes. However, people who are 65 and older are still disproportionately dying from COVID-19 than those who are younger. Next slide, please. Oh, there we go. So what happened today? So today, Wake County, we began our waitlist registration for 65 plus. That started at 8:30 this morning. Not every plan goes as smoothly as we wanted. Our call center and website were pinged a lot. So our website specifically was pinged hundreds of thousands of times, and our call center was called thousands of times in a matter of minutes. So the way the process will work, those things are back up, is that we are going to direct people to our website or our call center. They will then fill out a questionnaire, whether it's on the phone with a call center aide or directly on a website using a form. They'll then join our wait list. They'll receive a notification, and this is some confusion. So you won't immediately get an application to sign up and come on and get an invitation. And that's really why it's a matter of semantics, but why we called it a wait list versus a reservation. If I make a reservation at a restaurant, I know I will have my table ready at 7 p.m. on Tuesday, whereas if it's a wait list system, I will find out when it's appropriate for me to come in and schedule my appointment. But when you make your appointment with us, we will have a guaranteed dose for you, or a guaranteed quote unquote table. And you'll receive your notification, you'll get registered in CVMS, and you'll also get registered on through our Sign Up Genius, through our appointment portal, and you'll come in and get vaccinated. At the end of your first vaccine, we here at the county have only received Pfizer's product. Around 19 days later, you'll get a notification to remind you to schedule your second appointment if you haven't done so already. So the CVMS system will also remind you. So you'll get multiple notifications. It's also important to point out in the notification field, you have an option of 1 or 2 or 3 different ways. So you can get a text, an email, or a phone call. And you can also schedule your appointment immediately after you're receiving your first dose. So you can get your vaccine dose while you're waiting the 15 minutes to make sure there's no adverse events. You can scan a QR code right here and do your appointment, or you can call the call center and they'll be able to set you up with that secondary appointment. Next slide, please. So the demand far exceeds the supply. So as I mentioned, we had 180,000 people who are eligible to come in and get their vaccine in the first two groups. As of 11:30 this morning, we've had over 8,000 people request to be on the wait list for the vaccine. And I can report that as of now, maybe 15 minutes ago, we've had over 23,000 people reach out to us. Of all the Wake vaccinators that I mentioned earlier, through last week, we've received 33,450 vaccines as a system, so including our health system partners, our hospital systems partners. And us alone in Wake County Public Health, we've received 5,850 first doses. So we are also getting people's second doses coming through, and we have administered over 4,000 vaccines as of this Saturday night. So we are moving right along, getting doses in arms as quickly as possible. Our hope week over week is to exhaust our complete inventory, but knowing that we have scheduled appointments for everyone. So if you have an appointment scheduled, you're coming in, you're getting your dose. It's earmarked for you at that point. Next slide, please. Key thing to remember, until we reach herd immunity though, after your first dose of vaccine, you're around 55 to 60% efficacy. After your second dose, 7 days after that, you're around 95%. So even though you can still transmit and get COVID after your first dose, it's still important to remember to wear your mask, wait 6 feet apart, and wash your hands. Another key part here is that we want doses out as quickly as possible, because even a 55 to 60% reduction is a huge improvement over 0% without any vaccine protection. So we're doing everything in our power to make sure that we have doses in arms as quickly as possible while following the state's guidance of phasing and making sure that we have the most appointments available and working with our hospital partners. So it's day to day, it's week to week. We're managing, and for me right now, it's a numbers game, and I hope to have more doses allocated to us through evidence that we are, vaccinating people as quickly as possible. And with that, unless Jana or Dr. McDonald have anything else they would like to add, we'd open that up to some questions.
All right, thank you for that update. Board members, any questions? Mrs. Cash.
So just a couple quick questions. So our ability, so we get the number of doses based on how we distribute them. So the more we distribute, the faster we get more doses into the county. That's what I understand, I think.
Yes, Mrs. Cash, but you must consider that there are still extremely limited doses. So we would not necessarily receive 10,000 doses next week if we could show that we have that, because nationally the supply is still limited, which limits it to the state, which limits it then to each of the counties.
Do you know that the state would not get enough doses from the federal government if we administered them quickly?
The state will get more doses if they're administered more quickly, and right now the state's guidance is to, which is, I believe, one of the reasons why they opened it up to those individuals 65 and older, because you have some smaller counties who don't have a large number of healthcare workers, and so this enables them to use their allocations as well to the high-risk community.
Okay, so as of now, considering your feedback, aren't I? Am I getting feedback? 1 and 2. So healthcare providers now have already started to administer their second doses in their hospitals to their employees. And so mixed in with the 180,000 over 65 that we have, we still haven't taken into consideration that within 17 to 24 days, I think, those will have to get their second doses. So now we got to mix all of that in the mix of all that. That's an awful lot of doses that will be administered by Wake County prior to reaching our level 3. Are teachers in level 3 at this time by the governor?
Jason, I believe they are, aren't they?
Correct. As of now, they still remain in the frontline essential work group.
So what is your estimate of when those teachers could begin, considering the numbers that you have in front of you, considering the second doses that will be given, what is your estimate of when we'd get to level 3 in Wake County?
It's hard to predict an exact date, but I would say weeks to months. It all depends on how many doses the county as a whole receives. So if our hospital partners get allocated, let's say we each get 4,000 doses a week, that went from going from 4,000 total to, 16 to 20,000 doses. That makes a bigger impact on that population and being able to actually vaccinate them. So it all. And it's hard to answer that because we don't know our allocation, just like the state doesn't know their allocation until the week prior. So weeks to months is the answer, is the comfortable answer, which is not definitive, which is unfortunate.
Thank you.
Dr. Martin.
To follow up on Ms. Cash's, can you help us just a little bit? If I understand correctly, the 180,000 is the eligible people in groups 1 and 2. Is that correct?
Correct.
And do we have any estimate of the size of group 3?
We estimate it to be an additional 140,000 people based on the prior definitions of frontline essential workers.
Okay, thank you. That helps. Particularly, we don't know whether we're going to keep getting this 5,000 to 9,000 vaccines a week or more,
right.
But just to get a framework of the size, that helps. Thank you.
Ms. Mahaffey.
Thank you. And thank you for being here and updating us on this. I can't imagine how this coordinating goes is difficult. My question is, the website that Wake County just launched, is that website specifically for the doses that you're getting at Wake County Public Health, or is that being done in coordination with hospital partners?
So yes and no. So most of the people who are submitting their form through our website or our call center are coming to us. However, in the event that Wake Med or Duke or UNC Rec say, we have the ability to take on 1,000 extra people this week, we got an increase in dose allocation, we will send people we will activate them from the wait list and send them the sign up link to, instead of our site, but to Wake Med site or UNC Rec's site or Duke site. So we're sort of the central collecting point and then moving people to the appropriate sign up based on availability.
Okay, so that was my question. I wasn't sure because I went on the site you had referenced, the My Shop, My Spot NC website, and I just looked in, 4 different numbers to call and a different website
Right.
especially for our older population who may not use the internet. I appreciate you guys working and coordinating with them to make distribution a little more smooth for folks looking to get vaccinated. Thank you.
Thank you.
Mr. Haggerty.
Thank you, Mr. Chairman. I want to thank Ms. Sharp and staff and everyone with the county for all of their work to help expedite the vaccine distribution and the availability of the vaccine in Wake County. I have some questions, and unfortunately, you all may not be the right ones to answer, but I'm trying to get as much accurate information as I can. So I have a couple questions. If you can answer them, that's fantastic, but if you can't, just let me know. I want to follow up again on something Ms. Cash had talked about. I just want to be clear. Do you think that approval of additional licensed providers in Wake County would increase dosage available in Wake County, or do you think we would have the same dosage just spread among multiple providers?
I think if the state is allotted more from the federal level, I think that would increase access and not only different locations, but to your point, an additional subset of population who is getting vaccinated actively. If they increase the providers, but in some counties or some locations, there's excess of doses. So let's say I don't have the ability to vaccinate 1,000 people this week. Can I transfer it to my doses to a primary care provider who can vaccinate quickly? I think that's another option. For us here in the county, we don't have that problem. It would be more about increasing the number of providers as well as increasing the number of doses allocated to us.
Great, thank you. And related to the doses that are apportioned by county, Wake County Public Health only gets I think I heard under 20%, 16% maybe of the vaccination doses that are available in the county?
That's correct, sir.
Okay. So with our county's regional hospitals, we obviously serve many citizens from outside of Wake County. Are you aware of anything in the funding formula that takes account these greater needs? I know that you said we had more licensed healthcare workers, we had a larger, older population. Do you have any insight into how that distribution formula calculates that, or is it done some other way?
I don't think the state has been, we're not privy to the state's algorithm, but I'm not sure. And I don't know if anyone else on the call John or Kim has seen more detailed information, but I have not.
Yes, this is Jonna. The state has just instituted a new questionnaire that asks us not only what our current availability of doses is on hand, but what we have capacity to handle in the upcoming weeks. So they're asking that of all the providers. So they will take that information and determine how best to allocate those, still given their extremely limited doses. So it might help give you some context that this week, the state, for their allocation that they're distributing around the state this week, only has 140,000 doses. Last week, counties in general asked for twice that amount. So we have our plan to be able to vaccinate by the end of this month, hopefully at a minimum 6,000 people a week. That would be first and second doses. And while we have that capacity, in order to do so, we've got to have the vaccine. And for the state to give us more, they have to get more from the feds. And we continue to make pleas to the feds, and Vice President-elect Biden has rolled out his vaccine plan with a large part of that commitment to be getting more doses more quickly, which will help everyone.
This is Dr. McDonald. I just want to add on to what Ms. Sharp was saying, and that is to say that Wake County is making a hard push to increase capacity. That's Wake County Public Health partnering with the hospitals, as Jason was saying, as Dr. Wittes was saying, in terms of being able to give them people when they have extra doses, but also us reaching out to providers in the community that may have significant size populations in the current group, or potentially vendors in the community that can assist in also getting out vaccines. So we're trying to multiply our capacity by partnering with others and telling the state we want these folks to get vaccine too.
Thank you all. I appreciate that. Just my last questions. Are you all aware, because I've heard from people, but I have not been able to confirm, that there may be vaccine available to some residents through other sources that wouldn't necessarily be taking the doses that come through Wake County Public Health? For example, do you know if veterans are available to get vaccinated through like the USVA, or has the state made the vaccine available to any other target populations in Wake County, or the federal government made it available to anybody else in Wake County who might be able to acquire it from some of those other sources?
I'm not sure off the top of my head, but I can look into that and see. We do get an allocation list that shows what sites have received what vaccine for that week, but I have not seen specifically for a VA hospital or VA partner, but I could definitely look into that.
Thank you. And then just
just to follow up on that, one thing that we have been learning as we've gone through this process, right now, for the most part, federal agencies are expecting their employees to get their vaccine locally. So, for example, we've already learned from the airport that their TSA agents who are federal employees are expected to get their vaccine here locally. They would not come into play until the essential workers in Group 3. But so, and in reviewing the allocation list for the past couple of weeks, the predominance is just the local hospital systems and the local public health departments.
Great, thank you. And so finally, I'll just say, if there's anything that we can do to aid and assist, we want to help, not hinder, your advocacy in getting everyone vaccinated as expeditiously as possible. Please let us know. Thank you.
All right. Any other questions? Ms. Johnson-Hostler.
I just have one follow-up, given, I had it before, but definitely now that you've spoken into federal employees, which certainly does make a huge difference for a county the size of Wake to also be inclusive of federal employees. Does the CMVS actually track so that you all can see where people are, where they actually live? So to one of my colleagues who mentioned, our hospitals serve people outside of our county. Are you all tracking, are our doses going to Wake County citizens, or, as we all know, citizens cross county lines all the time for physicians and other things? Are we tracking that, and is that then being reported to DHHS to kind of show how many citizens perhaps outside of Wake County we're serving in addition to the Wake County need?
So we can track that in CVMS. However, CVMS has not been updated yet for us to generate our own reports. To your point, we have requested that same report from the CVMS state system over a week ago, and we have not gotten the report back as of yet. That is something that we'd be interested in knowing. When you sign up for a provider, as a provider here with the system, you can't turn someone away because they work or live in a different county as well. So that's an important caveat as well.
That's exactly why I asked, because I knew you couldn't.
Yeah.
So I was just curious if we had a way to manage that kind of data. Thank you.
Yeah.
Mrs. Cash.
Yeah, just to add another layer on that, as Ms. Johnson-Hostler talked about. So my understanding is that, and I know you haven't been able to track this, but you might want to see how this works out for Wake County. If you are on my chart, Duke My Chart, or Wake Med My Chart, and you're a patient in those, no matter what county in the state that you come from, if you register through that, you can get your vaccination at Wake Med or Duke Raleigh here in Raleigh. So that would be quite a few people that are patients across the state that go to physicians here. And at this time, greater than 65, those patients are actually going to Wake Med, most of them, to get their shots.
All right, seeing no further questions. Again, thank you all for that update, and I'm sure that we will continue to receive information and working through Superintendent Moore that will be brought to the board. And we certainly look forward to our teachers getting in there very soon.
And I'd like to just take a moment to thank our colleagues from the county for joining us today. This being the first day of the vaccination rollout in the community, and asking them for some time is no small feat. I know they have a lot on their plate today and every day, but today in particular. So thank you.
Absolutely.
Thank you. It was our pleasure to be with you this afternoon.
All right, the last item on our agenda is an update from the ABC Science Collaborative. So again, we'll turn it back to Superintendent Moore.
Good afternoon again. I believe that it's Dr. Benjamin who is joining us today, and he's got a shorter, briefer presentation today. I'm not sure if he's already logged in or not. Checking to see. Yep. Yeah, Tim says he doesn't see him yet. So just as some context for the prior conversation that we were having about vaccine, according to the Department of Health and Human Services dashboard at North Carolina, the state has received about 1 million doses at this time, and about 400,000 have been administered.
So who can we talk to about that gap and do some advocacy? That's a right. I mean, and that's we're not moving that. And I've heard nationally that there's vaccines that are just going dormant and not, and that's. But who can we reach? We've got enough on our plate that we can't. That we really need some help on getting vaccines to our staff and our frontline workers
Right.
and our.
Well, the North Carolina Board of Pharmacy offered almost 300 immunizers volunteers, and they have not been taken up by.
So it's not the volunteers. So how do we?
I do think we need to explore a little further this idea of the capacity of the requesting agency for the number of doses, in particular seeing that if she said that this past week there were 140,000 doses distributed and 5,000 of those came to Wake County, that would seem far less than the per capita that we represent.
Correct.
And I don't know if that reflects what we requested in terms of capacity or some other variable. And so I think
So I told with Cash today, I had another board I sit on, DHHS actually presented this, and they're very clear the way they have to, sorry. Listening to a presentation on another board I sit on from DHHS, Dr. Wong, they were very clear at the process in which they initially started, which was around per capita distribution. But once they look into the CVMS and see how you're actually administering the doses, that determines the flow of dosage. And so, I think all of us have talked to more than half of the Wake County folks, so we know what some of the backup was for them last week. Because last Thursday, when they looked at their dosage, we still had our 1,000 still sitting in the system. The other counties had already administered theirs. So it was a process perspective in the way, from what I understand from Wake County, of how they were making their appointments, which was very different than other counties, who, as they were coming in, they were just executing and so I assume we now know that in Wake County, so we'll change our process, I assume. But that certainly was very clear. The word she used is, if you're not using them, then they ding you and reduce the amount you get.
We need to ask for help from other providers because they're out there just waiting.
She did say that those providers can sign up on the state website because they are, even if they are physicians or pharmacists, according to DHHS Dr. Wong, they have to go through their mini training to actually administer it. And so
Yeah, the Board of Pharmacy signed all of them up through that site because they're all certified immunizers, so they had to be that way. But as of now, none of them, only I think 2 pharmacists of the 300 have been reached out to by the state.
And just as a additional
Which I guess that's
point.
my point is, I mean, for us, that's state advocacy, not anything Wake County can do because the state has to approve that.
Right. And just as an additional point, we are messaging to our employees directly who are in the categories that are eligible about how to access and get on if they are interested in getting the vaccine. So we're doing that messaging directly.
And then you'll send them to the pharmacists.
Let's see. Wherever they can go.
Okay, got it.
Okay. Okay. I do believe Dr. Benjamin has joined us. Thank you, Dr. Benjamin, for joining us this afternoon. I know that your presentation is a little briefer today. Go ahead and turn it over to you to get started.
Great, thanks a lot. So thank you all for having me today. This is, again, the ABC Science Collaborative. Go ahead. But there we go. So as usual, the information here is to help to be of service to school districts, but we're not here to make specific decisions nor advise specific action. And this slide does not have, but should have on it, the NC toolkit. As a reminder to all folks who are on the call, which is a really good resource, not only for schools, but elsewhere. Go ahead, next slide, please. So just a few reminders. So the ABC interacts with districts on a voluntary basis with the districts. We do have funding from pilot funding from the National Institute of Health. The faculty involved are all volunteering our time to the effort. The funding that is provided goes to pay for the staff time. We are not paid by the state. We're not paid by the county. We're not paid by the school district. And for the faculty, we're not paid for the effort at all. The data that we provide and data that comes from other studies are one part of the decision around remote versus face-to-face instruction decision. And as I've said before, I think several times, hearkening back to August, not only do I not have any knowledge of staffing or the 10,000 other items that go into a school board or superintendent's decision around remote or face-to-face, it's not something that we touch on. We're here about the data. I was asked to touch on emerging science for this particular meeting because it has been presented in the press. Go ahead, next slide, please, about coronavirus variants. So several have been recently described. 117, which first started being described related to United Kingdom. 1.351, originally thought to be originally from around South Africa. But this will also, here sometimes referred to as 501. And then one from Brazil. Now, as these variants have come out, there have been a number of questions around them. And these are, of course, unknown for certain, but we'll get into them. Transmission. We've got some data here, and it's unknown for certain, but it's thought that they're more easily transmitted. They have emerged to be the predominant strain in several counties. Early estimates on the increased transmission are around 35 to 59%. And because of how rapidly, especially the 117 and 501, emerged to be the predominant strain, it's very solid early data that transmission with these are greater. It is unknown if transmission is more efficient despite mitigation measures. Specifically, we don't have evidence that this can come off as sounding a little bit facetious, but we don't have evidence, for example, that they pass through masks any easier. The virulence. So this is unknown, but is hoped to be no different. And there's not data that the virulence itself is different between the variants. Now, because transmission is likely to be a bit more efficient, up to considerably more efficient, the virulence can stay the same, and we can, as a community, unfortunately suffer more deaths. But the virulence for any one person infected hoped to be no different, and no data suggesting otherwise just yet. Vaccine efficacy is unknown, but potentially no change. This has to do with a couple of reasons. One has to do with immunology. Our immune system is a complex environment, and immunity consists of not only antibodies, but it also consists of CD4 T cells. Think of T cells as kind of the quarterbacks of the immune system, and other components that a balance of those factors is really important. And when we design vaccines, especially around this particular organism, or this particular virus, rather, we look specifically for something called neutralizing antibodies. Now, the neutralizing antibodies are something that you, if you've got the spike protein, you can, and as a reminder, the virus proteins cause for a binding or connecting to the human cell that gets locked into place. You get entry into the cells. Antibodies disrupt that lock in place. And so when we get vaccinated under the mRNA technology, those vaccines are designed for the body to develop antibodies when the protein of the virus that is responsible for docking with the cell, that protein is in pre-fusion configuration, and we then develop antibodies that block this relationship between the virus and the cell. But there's other components of immunity that are important to the equation as well, and that's why ultimately it's hard to know. But preliminary data suggest, and this is based on an early study of 20 patients, that's why we're talking preliminary. Preliminary data suggests that when we take antibodies that folks have made against the older variants, those antibodies on the petri dish, if you will, in the viral media, if you will, outside the body, those antibodies are effective and are likely to be effective within the human. So unknown for certain, but we think probably no impact on vaccine efficacy. Now, why do we get variants, and what impact might they be on any kind of school decisions on any kind of policies around schools. Well, the European Union is struggling quite a bit around some of the new variants. And as a reminder, the policies in Western Europe, for the most part, have been to open without strict adherence to public health mitigation strategies within schools. And so I anticipate that there'll be a considerable problem in Western Europe because they don't have the mitigation strategies in place. Whether or not there's differences for schools in the United States where some districts are outside of North Carolina are not doing much in the way of mitigation strategies, I speculate that they're going to have considerable problems with these new variants. It's unknown as it relates to districts that don't have, that are putting in place mitigation strategies. I'm much more hopeful, however, for districts that put in place mitigation strategies. And regardless, these new variants are going to make strict adherence to mitigation strategies much more important in 2021 than they were in 2020 for schools that do make the decision to do face-to-face instruction. Now, why do we get variants, and are these going to continue popping up? And the answer to that is that viral genetic material is much more simple than, say, mammalian genetic material, human genetic material. And so there are, and in any one human, in some viral infections, you can have 10 to the 8th and 10 to the 9th levels of virus. So you have a combination of lots and lots and lots of virion and not a lot of fidelity in how the genetic material is replicated, and the theory of evolution coming together in a difficult intersection. And so we're going to see quite likely variants become a recurring story throughout 2021 and 2022. And we see it's not quite the same story with influenza, but I think a good way for lay folks to think about it is just like you need to adapt with flu vaccine every year. Eventually, we may be in a situation where we may need to adapt vaccines downstream, but that's not today, thankfully. Go ahead, next slide, please. Good. So the good news on the variants, probably not impacting as it relates to vaccine efficacy. Unfortunately, transmission is probably more efficient. Thanks.
Thank you, Dr. Benjamin, for the brief update. Are there any questions from board members at this time? Ms. Kushner.
Thank you, Chair Sutton, and thank you, Dr. Benjamin, for being with us today. You've had two associated papers being published in the last few weeks, so we've been receiving those from members in the community. So congratulations on that, getting all that published. But it's oftentimes some of the qualifiers, some of the context of your work is not being as broadly, the community doesn't seem as broadly aware of some of the fine points, some of which you've gone over. I just feel like I was in a biology lecture just now. But can you give us some ideas of the information sharing and ways that we can place your work in context for the everyday, high school student, family, community member? Because we've had your papers quoted on both sides of some of these issues.
All right, so there's strengths and weaknesses to any manuscript, and that's especially true when you don't have a randomized trial. So any kind of epidemiologic work is going to have substantial strengths and weaknesses and open to flaws. I would say taking maybe a group of flaws together and then a couple of strengths. I would say number one is some of the kind of the most concerning, which would be that these data show that we should simply reopen. You see this sometimes quoted in other states other than North Carolina, where there's not a mask mandate and there's not some of the mitigation strategies that are done here in North Carolina. And as we have said multiple times, that is a recipe for disaster. I would say number two would be it's important to note that there was extraordinarily strict adherence to the mitigation strategies. We had superintendents, school leaders, and school staff doing walkthroughs to document the fraction of people masking. We had districts set up ways for folks at the school level to report their concerns. We had superintendents and other school staff reviewing video to ensure adherence. We had a lessons learned where superintendents would, based on whenever they had clusters and secondary transmission, would engage in a lessons learned process. If those things aren't in place, you're asking for trouble. I would say number three is that the data were collected when these districts predominantly were in hybrid model. I was asked this by this particular board. I know y'all know this well because I seem like I got asked this a number of times. Yes, those districts have continued to collect data, and yes, some of them are in Plan A, and yes, they are having some success. But fundamentally, these data were collected in the hybrid model, and these data really apply to the hybrid model. And I think you all experienced this in December, where the data are fundamentally about within school transmission. So that if you don't have enough people, if your community transmission is so high that you don't have enough people for staffing and backup and things like that, that can be a real problem. I would say that and again, we don't have knowledge or line of sight onto that. And as I've said in this board meeting many times, that there's kind of the medicine of, are you having secondary transmission? And then there's the human resources part around staffing. I would say another item, again, we outlined this in the paper, I've outlined this to this board before, has been around the testing was voluntary. And so testing's not 100%. We've gotten permission to go back and assess those numbers. And so we will be getting more detail on that. We're going back and forth, negotiating right now with the IRB as to what we can do along those lines. But in the current iteration, the data don't have a standardized testing, and so it's certainly the case that just like in the community, not everyone is tested. In the schools, not everyone is tested. It is pretty clear based on both clinical experience and how kind of the robust nature or the greater emphasis on contact tracing that's done in schools than in other parts of the community. Testing, if anything, is more frequent for folks in the school environment than in the community, probably less frequent than those of us in healthcare experience. But again, unknown. Some of the strengths of the work have also been discussed here before. That includes the fact that it's a substantial sample size. It's got 11 different school districts. They are from the state of North Carolina. So for North Carolina counties, there's a fair amount of applicability in the sense that the guidance from DHHS is similar county to county, or the same county to county, in contrast with some other states. Other strengths include even if only half of the participants who were considered exposed were tested, you're still, if you have a rate of infectivity similar to the source population, you're looking at still an extremely small number of within school transmission. So the job done by the districts at hand is really there to be commended. They did an outstanding job. This is by no means a zero risk environment, but it is a environment I would say to be proud of, to a much much lower risk environment than traditional thinking was in July and August of 2020. The other strengths are there was a fair amount of variation in the community transmission between the counties, especially as we got into October, with some of those counties at 800 or 900 per 100,000 population for 14 days. Unfortunately, Wake is now at a higher transmission than even that, according to the DHHS website.
Yes, we've been trying hard to follow that as well. And I appreciate you underscoring the need for mitigation efforts to continue and to be vigilant along those Swiss cheese layers that y'all lay out so well. And I also appreciate that the commentary that came out in the North Carolina Medical Journal focused on the need for schools to have the resources to do those mitigation practices as well as other resources so we can serve our children. Thank you.
Yes, ma'am.
So again, Dr. Benjamin, thank you for being with us. We appreciate the information and the update, and we will certainly take what you have shared into consideration.
Great.
Thank you.
Thanks for all that. We certainly look forward to continued partnership with you all. The mitigation policies that Wake County had put together. I know I told you all this earlier. We have put together as a program is expanding nationally right now. Multiple Wake County documents are in that national playbook and that national package that's now going out to about 10 different states across the country. So we're moving the North Carolina program into a number of different states where maybe the baseline mitigation strategies are not as strong. So I appreciate the work that Wake's done in our partnership.
We thank you for promoting our work, and we are real pleased with our effort, and we continue to work on it and try to improve each week. Mr. Haggard, you got to.
Yes, sir, Mr. Chairman. I know that we have limited time in these meetings, but that I know myself and several colleagues may have additional questions for Dr. Benjamin. Is there a process for submitting these questions, or is there a recommendation you would have where we could pass on some specific questions, perhaps either for addressing at a future meeting or just addressing us directly?
Let me punt that question to Superintendent Moore. She is pretty much our liaison between the board and Dr. Benjamin.
I think it would be helpful when there are questions, and they have trickled in here and there different times from board members. If you can send questions that you have to me and copy all board members so that they're aware, so in case so everybody knows what's being asked, then I can work with the folks from ABC Science Collaborative on how to best respond.
Great, thank you.
And Mr. Haggerty, thank you for that question. Part of this now is just simply a question of hours in the day, right? And we were at kind of Wake was one of 50 school districts. Now Wake, an important partner for us, but one of 50 school districts in one state of 10 states. And so the program's now expanded by essentially one log. And on a student population basis, the largest school district we think we're going to be working with starting in about 2 weeks is about 450,000 students just for one school, one of the school districts that we'll be working with. So, you know, we want to be able to batch those up as efficiently as we possibly can, and yet provide outstanding service and a partner that picked us up as an early adopter, B, a team between the superintendent and the board that had a lot of foresight that this would really be a good partnership, and C, has done really so well in the mitigation strategies. We want to be extremely mindful of the, you know, essentially the debt that the program owes to, you know, to Ms. Moore and to the board.
Thank you.
Thank you. Mrs. Carter.
So I just had one other question. Is the floor still open for that?
I'm sorry.
Can I go ahead and ask a question now, or are we being asked to wait until later to ask questions?
Dr. Benjamin? Sure. Go ahead.
Okay. All right. Thank you. I wasn't sure. It sounded like it was wrapping up. I guess I just wanted some clarification. I know we've heard from several folks who question if your study findings, how we should use them, how we should consider them or view them if the community spread is higher than when you collected the data. And so I guess I'd like to hear directly from you as what your recommendation would be for that, because I know we've received quite a bit of feedback about that. Thank you.
Sure. So let's see. So some strengths. So I think that you want to think in two terms. One is what is risk of transmission within schools, and the other is managing everything else around that decision, right? So that's the first kind of fork in the road. And I think that even if everything goes perfectly around within school transmission, rates in the communities can impact schools in ways that have nothing to do with secondary transmission. Okay. And you guys have talked through those before. You know, schools, the primary metric for schools should be how much transmission do we have, how much secondary transmission do we have in our schools? And that's really what you're trying to prevent. That's the key metric. And you all as a team had some hopeful early data in October, November, and early December that your mitigation strategies were very strong and working well. You know, as community transmission goes up, those mitigation strategies and adherence to those and strictness of adherence only go up. It's clear from, if you're a resident of, you know, Alexander County right now, where the cases are more than Wake County or Yadkin or Ardell or Gaston, that those schools are having success or had success up through, I got data from Ardell last night. As of last night, they were still having success in Plan B in their school district. And so it's clearly can be done It's a very different question than what should be done. Is that helpful?
Yes, thank you. Sorry, couldn't get my.
All right. So again, thank you for that, those questions, board. Thank you again, Dr. Benjamin, for that information, and again, for taking the time out to be with us. We know your schedule is quite tight and busy these days.
Great. Thanks, you all.
Thank you. So that wraps up our our work session agenda for this afternoon. We've got a little bit of time here, so we will try to maybe tackle a few closed session agenda items. So at this point, if I can entertain a motion to go into closed session.
Chair Sutton, I'd like to make a motion that the board go into closed session to consider confidential personnel information protected under GS 143-318.11A1, A3, and A6, to consult with the Board of Education attorney and preserve the attorney-client privilege as provided in GS 143-318.11A3, and to consider confidential student information protected under GS 115C-402 and the Family Educational and Privacy Rights Act, 20 U.S.C. 1232G.
Got a motion from Ms. Mahaffey, second by Ms. Kushner, to go into closed session for the items just stated and that are listed on the agenda. Is there any discussion? Hearing none. All those in favor, show by sign of aye.
Aye.
Any opposed, nay. Ayes have it. We now stand in closed session. Thank you all for joining us today for today's work session, and we'll see you at our public meeting at 5:30. Thank you so much.